you're working from home until July. Will you be keen to keep that in place?
I'm actually like, I think a lot of people now just want to get back to work. We used to complain about waking up early and, doing that daily commute into work. But I think everyone now really just wants to get back to normal. My day job is in the youth job and youth and community field. So my work is, direct and face-to-face work, which I haven't been able to do. And, for the young people that we do work with and engage with, initially, I think for them, it was okay. They got a bit of a break from us. But now, they're starting to lose a little bit of that structure. So, there is a need for us to come back and start building up those relationships. But I'm certainly keen to get back into work, doing the direct work that I really enjoy. It's just I have to really consider at that point, where are we in terms of coronavirus and the control? What are the social distancing guidelines? Because bringing a young person into kind of a small, cozy room to do a direct work session isn't going to be able to be done. How can we use technology such as Zoom to carry on doing that type of work? So there's lots of different factors there, but certainly for me, I'm quite looking forward to getting back and going to work.
And Elise, just like Reece, your work is very people-facing. I mean, that's the whole reason, I guess, why you wanted to be a NHS midwife. It's because, it's that sort of area that you feel really passionate about, the caring of a new mum and the delivering of a baby. So are you quite keen to get back to doing what you were doing before?
Yeah, I think it's obviously, I've been lucky to be able to be put on the phone line and not have to be taken out of work completely. At least there's something I can do. But yeah, I went into the job to be there for women and for partners and to be patient facing. So yeah, I am really looking forward to getting back to work. I'm quite bored of my phone voice now.
And in terms of me, like I mean, a lot of people will have seen this. This has been my area of work. This, I guess, probably 4 by 3 meter room here, with lights and cameras and screens in it. This is where I've gone to work, and I'm getting a bit tired of the endless Zoom interviews, and I'm sort of losing the inspiration that I had, because I'm doing the same thing over and over again. But the alternative would be out and about interviewing members of the public every day, going to various different locations. Because I work in news, no doubtedly the majority of them would be coronavirus hotspots. So when I think about it that way, I think I'm probably keen to remain sort of working as home for as long as possible. Which, I mean, as I think a lot of us have proved, we can do some portion of our job from home. But Sam, what's it like in your area with your friends and your family? What's going on with returning to work in your life?
So I don't go out to a job. I'm very much a homemaker, I'd like to say.
It's still a job. It's still a job.
The hardest job is the fact that I do have a husband who was basically told to work from home starting 2 weeks before the official lockdown. So, I mean, having to deal with that's been a job in itself, along with having 2 adult children, I like to call them, at home as well, who've also both been working from home. So essentially we have 4 adults in a house all the time and a dog, which has been testing at times. We've got on very well, but just the fact that I've got one person who needs a lot of Wi-Fi for important work calls, a daughter who's been doing university lectures online needing Wi-Fi, a son also doing lectures online needing Wi-Fi, and at the same time I'm going, yes, but I want to do a dance class and that's on Zoom and that needs Wi-Fi. It doesn't always work. So those logistics,
Absolutely.
it's its own logistics.
Absolutely, that's entirely valid. It's, can our home system support it? And let's not forget, with us all working at home, our overheads are going up. We're paying for that Wi-Fi, that electricity, that heating, even though we don't particularly need it now, but we did when lockdown started. You know, those are costs that we're incurring, and of course we're not going to go to our employers cap in hand, because I think a lot of us are quite grateful to continue to stay in our jobs. But it's, you know, it's worth considering the impact on our home lives, and that's probably why, one of the main reasons why I didn't, you know, go to live with my parents through this, because I really need a solid, strong internet connection to do what I do, and it just would not be possible. I've tried it in the past to work from my parents' house, and it's just it's impossible, because the upload speeds are so slow, because like you mentioned there, Sam, they do live in the sticks and Wi-Fi is terrible out there. But there are things to protect us. So if you're not feeling safe about going back to work, then you know you can do something about it. As someone living with diabetes in England, Scotland or Wales, your rights to work are set out in the Equality Act of 2010. So you're also protected in Northern Ireland too. They've got the Disability Discrimination Act of 1995, so you can and should ask for reasonable adjustments to be made wherever possible. And I think I would encourage people to work from home while they still can, while we're still finding out about how we're going to live with coronavirus and COVID-19. Because I think although a vaccine is becoming quite quickly not viable, there are treatments and therapeutics in other drugs which could help people to live with the condition. But Elise, you have some responses from your social media followers. What were they saying about returning to work?
Yeah, I had kind of interestingly polar opposite ends of responses. I think it's probably quite dependent on what jobs people do as to how they feel about going back. So I had one lady who's a journalist, and she's not keen at all on going back yet, and that's mainly because of exactly, anything kind of people facing, I think, where news is going to be. Whereas a few other people were very much not wanting to stress about it at all, not thinking that it's, you know, that diabetes is going to impact them. We're trying not to have that attitude of thinking that diabetes will have a bad impact on going back to work.
And let's not forget, there's a whole army of people like yourself that haven't been able to entirely work from home. There's a lot of people who just haven't thought it, you know, pertinent for them to stay at home. A lot of people just didn't, either couldn't because they needed to go to work, self-employed people particularly. They worked in essential areas, so key workers. So a lot of people will have still had to go out there and take that risk themselves. But just in terms of the people that I spoke to on social media, so Pete Harris on Instagram said that he's a painter and decorator. He stopped working for a few days to get his PPE in order, and other than that, he's returning to work, but he is still turning work down left, right and centre where he doesn't think it's safe. Maria Greenwood said that she works for the NHS, so she didn't really stop working except for the time when she had symptoms, so she had a week off then. And Nicholas Adams said that he's type 1 diabetes and has had to make the agonising choice to work during this crazy time, as he's considered an essential worker. He's getting no hazard pay and initially no PPE, so he had to buy his own. You might say that he shouldn't have worked, but if I had, my workers' insurance would nearly have run out by now, and I have to pay for the basics like food, insulin and sundries. He says he is worried, but what choice does he have? I think it's important to mention there that I think Nick was getting in touch from the United States, so a very different situation over there again. And Mandy Dibble says, I'm a flight attendant and I've been flying during this whole thing. Haven't been sick or anything. Luckily, I'm going to continue on with life as normal and being careful, but continuing to work. Don't forget, if you want to get involved with your own opinions about returning to work, is it safe to do so? You can get in touch on our social media platforms. On Twitter, it's at All4OneTweets. On Instagram, it's at All4OneInsta. And on Facebook, we are at All4One Online.